Good evening and welcome to SACAP's webinar where we will explore the value of social work education and practice. I'm your host, Stephanie Dehan, and I'm the Social Media and Events Coordinator for SACAP. A few house rules just before we proceed. We will have a short Q&A session at the end of this presentation, so please feel free to send us your questions in the Q&A box located at the bottom of your screen. We are aware that there is high internet usage in the country, thus slowing down connection in some areas. We also know that load shedding might take place at any moment, and should you or any of our panelists be cut off due to this, kindly note that the recordings will be made available to you by the end of next week. Please be advised that we are still working from home, so should you hear an occasional microwave beep or a child in the background, we do apologize. Right, so this evening, Rahim will be taking us through understanding social work as an applied science in a changing world through his own experiences. So without further ado, Rahim, over to you.
Thank you so much, Stephanie. My name is Rahim Thawer. My pronouns are he and him. I am trained as a social worker. I received my Master's of Social Work from the University of Toronto back in 2011. And I've been practicing ever since. My area of focus has been in clinical practice, though I have done some organizational level work, program development, curriculum development, community organizing, and the like. So today I want to tell you a bit about why I chose social work. And for those of you who don't know, I am originally from Canada, but I am here as an international visiting scholar with SACAP. And one of the reasons I was able to travel and be a visiting scholar is because of my credential as a social worker. So let's begin. Back in 2007, 2008, about 13, 14 years ago, I was thinking about what my career path should be. And I was completing an undergraduate degree in psychology at the University of Waterloo. And I did, in fact, first apply for a Master's of Arts in Counseling Psychology. I didn't have very much community experience or experience in the field, and so I didn't get in right away. I would say that this was actually good. As I took some additional time to think about what it is I wanted to do, I realized more and more that social work was the right choice for me. Now, I'm not knocking psychology. It is also a good degree to have, but I want to tell you a bit about why I chose social work. So social work allows you to have a clinical practice. So if you're interested in counseling and psychotherapy the way I am and have been, social work allows you to do that. One of the things I really liked about social work was that it was social justice oriented. And so we were talking about the dynamics of power, privilege, and oppression in almost every course that I took. Even when we were talking about clinical practice, we were talking about the influence of larger systems and structures in the world. And I found that to be quite invaluable. I also found when I started to do more research about what I would do with a social work degree, the resources were aplenty. And what I saw more and more in Toronto, at least where I was that a social work degree could be used to engage with and work with many communities. And so the fields of practice were quite expansive. Whereas some NGOs might say, we need a counseling psychologist for a very specific program or specific role, that same NGO might say that, you know what, you're a social worker, so maybe you could do some counseling pieces, but you can also help us develop some programming or help us do some very specific outreach to a community. So these communities that I talk about, right, they could be youth, families, parents who are struggling with parenting skills or mental health challenges, people recovering from intimate partner violence, people who want to be better people after they've been perpetrators of family violence. There's such niche communities and fields of practice that you can zone in on as a social worker. And that's one of the things that really enticed me. couple of other things I would mention is, during my master's of social work, I was able to do an internship or like a practicum in Australia. And since graduating, any year that I've gone to a social work conference in Toronto, there's been people from the UK trying to recruit social workers. So there I've named two parts of the world where the social work credential was widely recognized and sought after. Now I'm here in South Africa, and lo and behold, a lot of my skills are transferable. I may not know everything about local culture or the dynamics of different communities, and that's something I'm here to learn. But by and large, a lot of my skills as a social worker and my analytical, critical thinking skills are translating just fine. Finally, if you think at all that you want to teach in an undergraduate or postgraduate program, consider taking the social work path. In my experience, and I've taught at three colleges, two or three colleges, and at least three universities now. The Masters of Social Work has been a credential that's been widely recognized as a credential to be able to teach. Whereas had I gone the psychology route, most of my peers applying for teaching jobs would have had PhDs. Now, maybe the teaching is different. And so again, I think psychology is a really great degree to have. In my experience, the social work route has been incredibly valuable as an applied science because it gets recognized as an applied science. Now I'm going to tell you a bit about social work and the lens it gave me in the fields of practice where I worked. I'm going to start with talking about the HIV/AIDS sector. So in North America, how should I begin this? In North America, some of the populations that are disproportionately affected by HIV are a bit different than in other places in the world. But by and large, one of the things I really loved about working in this sector was that there was a number of social workers that were my peers, and they came into the movement. They came into their advocacy work with a social work lens. And what that meant was we weren't just talking about an infection and how to support people through individual counseling, although that was a big part of our work. But we were also thinking about what we call the social determinants of health. What are the social and systemic factors that make people more vulnerable to new infections? Are we talking about power? Are we talking about poverty, access to good health care, access to adequate education, opportunities to dispel myths about transmission, etc.? So I came to see, it was through this sector that I really came to see the possibility of doing clinical work, but also being political and applying an anti-oppressive lens to my work. I was also able to think about and understand what it was like to work with older communities who had lost many people to AIDS before treatment was made widely available. And social work taught me about being trauma-informed. And being trauma-informed, without necessarily having specific skills in treating trauma, I was able to understand concepts of collective grief, mass loss, and survivor guilt. And those were concepts that I learned through my social work education. After about 5 years doing specific work around HIV and AIDS, I moved into working with children and families. Here, I relied on both my social work and psychology background. As a young adult, I had forgotten about Erik Erikson's developmental stages or psychosocial stages of development and a host of other theories. And as I worked with young people, I went back to look at some of my course material from my social work and psychology degrees to really recalibrate what I needed to know to work with these communities. I also was able to apply my anti-oppressive and trauma-informed lens to appreciate how trauma can be transmitted intergenerationally. And so when I went into family homes to do interventions or to talk about dealing with conflict more appropriately, um, or to support parents around their mental health challenges, I had this almost endless empathy. And what helped me were some of the values from my educational background. As a queer South Asian Muslim myself, I was always drawn to working with the LGBTQ community. And so that's where I circled back. And I spent about 7 years working at a healthcare center in Toronto. And I was on a health team. And the health team was comprised of physicians, nurses, health promoters, lab technicians, and many social workers who were acting as counselors and therapists. One of the things I really appreciated was that in a healthcare setting, a health center or a hospital, social workers were seen as essential to the service delivery process. They were seen as essential and vital to providing good care to all of our patients and clients. Working in that kind of setting, I was able to broaden my skills and even my knowledge base about how physical and psychological health are so connected. In this setting, I was also able to reach communities that I am part of. And that is something that's particularly rewarding and quite common in social work settings. So that's something I really appreciated. And I owe a lot of that to my social work background. Now, I want to tell you a bit about what you can do with a social work degree. So Steph, take us to the next slide. Some people will say, well, maybe I don't want to do clinical work. What can I do with my social work? Either it's a BSW, my bachelor, or my master's. Well, here's the thing. With a degree in social work, the number of roles you can do is quite versatile. So you might be able to do something like care coordination, or it's also referred to as case management. What does that look like? Sometimes it's getting people into appropriate housing or getting them into a shelter. Maybe it's helping them transfer from a shelter system to subsidized or government subsidized housing. People need help with meal planning, meal programs, getting access to dietitians, getting access to appropriate physical health care and appropriate programs for medications. Part of care coordination is also connecting clients to the programs in the community. Sometimes there's so many things available and a client needs one entry point and they need someone to help facilitate their connection to various programs. One of the things I like about care coordination and case management is that you can work from a client-centered perspective and help clients build their goals in their time with you. And their goals might be things like reducing isolation, getting connected to a bereavement group, or perhaps even getting connected to more specialized mental health care. Counseling is something that I think all of us are aware of. What is counseling? So counseling can be broken up into a few different categories, believe it or not. You can do short-term counseling or what we might call supportive counseling. So when somebody is going through a crisis and they need help with finding a solution, or they need to know what their options are, or they need to be able to talk through something briefly, we might call that supportive counseling. With the social work degree, you can also delve into and provide longer-term psychotherapy. That means you can work with people on an ongoing basis to help them uncover some of the challenging experiences they might have had in the past and help them make connections so that they can understand how it's impacting them in the present. The next function, that I see social workers having often, and this is in particular back home, is discharge planning. What does that mean? You may have had a loved one, or you may yourself have at some point been in a hospital or been recovering from something significant, either emotionally or physically. Discharge planning is a service provided when you leave an acute care setting and you need to make a plan for your well-being moving forward. Sometimes that looks like scheduling further checkups, or it can involve educating your family on what you've been experiencing and how they can help moving forward. It might be connecting people to outpatient supports so that they can continue to receive support on an ongoing basis after the acute crisis has been resolved. It can also be about planning and finding ways to get people in-home support services or to identify other needs they might have. So discharge planning is something that is, I think it's vital. I mentioned before that when I worked in a healthcare setting, the doctors and nurses found the social workers to be invaluable. In hospital-based settings, discharge planning is one of the things that few people can do other than social workers, because social workers often know the system of services much better than any other professional. That takes me to service and system navigation. In my experience, social workers, like any other professionals, can specialize in particular areas. So domestic violence, renal kidney failure, HIV/AIDS, surgical departments such as, surgical departments or eating disorder programs. So when social workers specialize in a particular area, they get to know the services that are offered for that particular issue at great depth and detail. And they're in a unique position to help clients navigate a system and services. They know exactly where to go. They can tell you what the eligibility criteria is for a particular service or program and how you can get there. They can also connect you to various groups, community programs, and individual care programs. Finally, I want to talk about program development because I think social workers are very creative. A lot of us have personal experiences that lead us to appreciate the gaps and needs of services and programs in the community. And social workers who may want to do frontline work or may want to do a combination of frontline, so direct and indirect practice, might be able to create programs that they think are relevant for the communities they work in. So some examples could be, and these are examples I've seen people create in my time. So creating social skills groups for adults, having a group or a program that focuses on self-esteem and mindfulness, working on substance use and relationship issues, talking about mindfulness and its role in everyday communication. These are all small programs and groups that I've seen that have been developed by social workers. When I was supervising social work students at my last workplace in the healthcare center, one of our students came in and for her practicum, she wanted to build out an advanced care planning program. What is that? I mean, the language for that might change based on the borders of where we practice, but essentially advanced care planning is about making decisions and having conversations way in advance of somebody dying, essentially. So it's about planning what your wishes are and what your needs might be if you were to become incapacitated. And so this social worker, this student, this was her creative idea, and she ran a workshop with all of the existing counselors to build our capacity so we could have those conversations with our clients. And she started to have those conversations with our clients and developed a form and some manuals for helping us to support clients. And the tagline around it was dying with dignity and having a plan that you're comfortable with. So I'm eternally grateful for the ability for social workers to do program development work and to bring their creativity to the field. All right. Now, you're thinking about going into a social work program. You might wonder, what are we going to learn about? Well, one thing I can tell you, having studied internationally from Toronto to Melbourne to now Johannesburg, there are some common things that social workers will talk about in programs internationally. And there is a huge emphasis on critical thinking skills. So you can expect to have conversations in your classrooms around decolonizing practice. What does that mean, you might ask? Well, we're often thinking about how to honor the traditional ways of knowing and ways of healing that come from the client groups we work with, right? How do we how do we think critically about the impact of colonization and intergenerational trauma and support people to work and heal from a system that has impacted them negatively? There's often ongoing conversations about accessibility. My social work degree and the discussions around accessibility help me think about what it means to make a service accessible, both emotionally, psychologically, and physically to people who experience barriers. So you might think about people who have physical disabilities or so for example, a wheelchair user, somebody who's non-sighted, somebody who is deaf or hard of hearing. What does it mean to provide a service or an accessible program to somebody who is living with that kind of disability? And accessibility is also about psychology and our emotional ability to access something. So how do programs that are based in a white Eurocentric model make it difficult for some communities to access? Right? That's an important question. What does accessibility look like when we want to reach certain demographic groups? So you can expect to have those critical conversations in your program. You'll also learn about what it means to be client-centered and to appreciate self-determination from clients, allowing them to take the lead role in their own care while you guide them and offer your own expertise in a way that's not oppressive. One thing that we begin learning about in our social work degrees, but carries on for the entirety of our professional lives, is working on cultural competence. That means being able to work with communities, whether they're culturally different than you or they're different than you based on some other kind of difference. Learning to work with those communities with competence, understanding other people's worldviews, and thinking about how to not recreate dynamics of oppression for those communities. While we also work within medical models, so for example, psychiatry, primary care, surgeries, we also work to challenge medical models. What does that mean? Well, it means that we don't start from a place of pathology. We often want to work and we want to learn how to work with people in a way that's non-stigmatizing and empowering, right? So social workers are some of the few professions that are really good at working with people without starting from a place of pathology. So those are some of the conversations you can expect to have that I see happening in the field of social work internationally. Finally, I want to share a few things about the SACAP approach that I've been really appreciative of. So SACAP, as the College for Applied Psychology, is a very unique program that sees psychology and social work as close siblings, two fields of practice that have a lot to learn from each other. There are psychology modules in the social work program. There are some social justice and diversity modules in the psychology program. What I think this is very beneficial to social workers and to psychology students. The reason for this is, in many of my experiences in educational institutions, psychology and social work are in competition with each other, or they're siloed in different corners of a university campus. With SACAP, we have the opportunity to really think about how we can learn from each other and grow as these two professions borrow from each other's rich knowledge. So on that note, I'm going to hand it over to Dr. Poppy Masinga, who is going to tell us a bit more about the social work programs at SACAP. Thank you so much for listening to me and my journey in this in the field of social work. And if you have questions, you can always put them in the Q&A box. Thank you.
Good evening, everyone. Thank you, Rahim, for an interesting and informative presentation on your experiences as a social work practitioner. I will be speaking to the value of social work education and practice in a changing world. Firstly, I'm going to be talking to SACAP's vision and purpose with regards to the BSW program. And then I will move on to tell you how the program was launched, the processes that we had to go through to ensure that our program is accredited and it's recognized. Also, I'm going to tell you about the other association that social workers need to register with that was part of SACAP's launch of the BSW program. Next, I will be telling you about the networks that SACAP is affiliated with that ensures that SACAP's program is of high quality and meets the norms and standards, both nationally, regionally, and globally. Then I will move on to tell you what social work's mandate is in South Africa, in Africa broadly, as well as the world over. Finally, I'm going to close by telling you that SACAP has subsidized the program to ensure that it is accessible to a wide range of students who want to study with us. As I said, that I will start off by telling you about our curriculum and how we deliver the program. As Rahim has said, that we're moving away from the medical model. Similarly, in South Africa, social work moved away from the remedial approach, precisely as explained by Rahim. The medical or remedial approach focuses on problems, focuses on pathologies, oftentimes blames people for the situation in which they find themselves. So in our program, as regulated by the CHE and the SACSSP, we moved away from the remedial medical approach to the developmental paradigm, which is a new approach that was established in 1997 when we achieved our democracy in South Africa as a country. Because we realized that most of people's problems, particularly in South Africa, were as a result of our historical past. A lot of people that we will be working with as professional social workers are experiencing the challenges that they are experiencing as a result of apartheid. The developmental approach also acknowledges that people are unique individuals and they experience challenges differently. And in that process of going through these challenges, people have got strengths, they've got abilities to cope, but they cannot do that without the support of social workers. Social workers have an important role and a critical role to empower, to enhance the skills that people already have that they were born with, and are not able to maximize those skills because of the conditions that were set up by apartheid and many other socio-economic and political issues that prevent people from maximizing their potential. On another level, we also adopted the social development approach. So in our training, when we train social workers, we want them to realize that counseling only or therapy only will not get people out of the situation in which they find themselves. We do realize that people need to be economically independent. They need to be economically empowered in order to be able to cope with their challenges. Therefore, we adopted the social development approach, which combines both the social and the economic to ensure that people can thrive. Additionally, our curriculum focuses a lot on advocacy. As I have mentioned, most of the challenges that our people are facing in South Africa are as a result of discrimination, oppression, marginalization, and disadvantage. Therefore, we train our students to be advocates. We train them to stand up and protect people's rights and to fight for justice, equity, and equality. What sets our curriculum apart from the rest of the South African public and private higher education institutions is our green social work and sustainable development approach that we've taken. We decided to focus on green social work, which is a new field that was recently established as a result of the climate change that we are experiencing as a country and as the world. Most of you are aware of the disasters that a lot of people suffer from. Currently, we're speaking about COVID. COVID is one of the disasters that are directly linked to the environment, are directly linked to the conditions in which other people live. Climate change affects the environment. It affects people. It affects plants. It affects animals. As a result, we decided that we want to see our engagement in teaching our students to be aware of the impact that climate change has on our people. We want to encourage our students to advocate for governments across the world to put their money where their mouths are. We want to advocate for the governments to begin to hold companies to account to ensure that in their economic activities, in their day-to-day business activities, where they're also trying to promote job creation, to enhance people's socioeconomic functioning, and to ensure people have got access to jobs. But we want to also make sure that they are not doing that at the expense of the environment. We want to make sure that we can protect the environment for the next generation. We want to make sure that all the programs and projects that we will be developing as social workers together with our partners like psychologists and engineers, we want to make sure that they protect the environment, they protect people, they protect animals, because we live side by side with these other species. Therefore, our program is unique in that space. It's unique, it's the only one in this country that is offering green social work and sustainable development as a module on its own. Most other institutions just talk about climate change and how it contributes to poverty, especially in rural communities where people rely on farming. We have designed a specific module that focuses on that. Our program, as required by law and by the norms and standards, is a full-time program, and we conduct it on a face-to-face basis, obviously being cautious and aware of the impact of COVID. We have put all the systems in place and all the protocols are in place to ensure that you will be safe when you come to our classes. We also use a blended learning approach. With the advent of COVID, we were forced to move to online. But we do realize that we need to move to normality because COVID is going to be with us for a very, very long time. If it's not COVID, it's going to be another pandemic. Therefore, we've designed our program to ensure that some of the lessons or the lectures, we will hold them online and some will hold them on a face-to-face basis. Finally, our program is focused on ensuring that our classes are small, but it's not small in the sense that there won't be productive and exciting engagement between students and educators. Our classes are small that you'll be able to get individual attention, that you'll be able to interact with your peers, and that you'll be able to interact with your educators and not feel overwhelmed by large classes like in public universities where some of the classes are as big as 1,000 in a class. In those such big classes, students tend to disappear and not be recognized. As such, they are not able to learn effectively. SACAP's program ensures that our classes are small and manageable, particularly during the times of COVID. Our classes are as big as 20 to a maximum of 25. I want to tell you about our profile of the students that we admit in our program. Currently, we have a diverse group of students, diverse not only in terms of race, but also in terms of gender, in terms of nationality, in terms of religion and culture and sexual orientation. We are an open university. We are a college that is student-centered, and we want to ensure that our students can learn in an environment where they can engage with other students that are different from them. Because one of the key principles of social work is that we should respect diversity. Therefore, we are practicing this in our classes. When we recruit our students, we want to make sure that all students that are willing and have the potential to study with us get an opportunity to be accepted into the program. Hence, we have even made sure that we subsidize our program so that we can even have students that come from poor and disadvantaged communities to be able to access education, which is of high quality and doesn't come cheap. We also want our students to be passionate. So if you know yourself, to be passionate about changing people's lives, to be passionate about being part of the exciting developments that are taking place in our country, you are at the right place. Thirdly, we want to make sure that the students that we admit into their program understand their ethical and professional responsibility when they engage in this profession. By ethical and professional, I mean people that have good morals, people that respect other people, irrespective of who they are and where they come from. People that will practice with people, ensuring that they engage in behavior that is desirable and they act as role models to our community members. As a result, we put ethics in the forefront. We're even providing a curriculum that focuses on professional values and ethics. I will tell you more about our study plan and how it is developed and packaged. We also want students that are socially aware, that are on a daily basis, keeping tabs and following what is happening in the country, in the region in Africa, all over the world, in the community in which they live. We want people that are aware of what's happening, are aware of how government is responding to people's needs. We know that South Africa is a country like many other countries that has complex issues, both socio-economic and political. So as a student, you will be expected to be aware of what's happening so that you can be engaging in class and coming up with strategies and interventions that are going to improve people's social functioning and well-being. If you're not aware of what's happening in your neighborhood, how will you be aware? How will you be able to develop interventions that are going to change your neighborhood? We also want to work with students that are open-minded, students that are not rigid, students that are flexible, that are willing to hear other people's views, that are willing to engage with people that are different from them or hold different opinions. People that want to learn and are eager to learn new things, are not just assuming that they know everything, because as individuals, we cannot say we know enough, and we cannot go around in our communities undermining the people that we're working with, thinking that we are experts. We do know that we will continue to learn until we die. Therefore, we want students that are eager to learn, that go an extra mile and not just rely on the educators in class, or that who don't rely on the notes that get given in class. We want students that will go out and find their own sources of information and share with their peers and their educators. Because the mode of teaching that we use, we don't stand in front of the students and lecture, because we don't believe we are experts, and we don't believe students come as empty vessels. We know that our students come with many diverse experiences, and some of us students also, we expect them to be already engaged in some community projects as volunteers. Therefore, this is the kind of students that we're hoping to attract. And if you think you fit this profile, you are at the right place. Our BSW is relevant. and it's valuable to our local context. I've been talking about Africa as a continent and the world as a globe, as we know that we're also now living with people from all over the world. But we make sure that our program is also relevant and wants to add value to the people of South Africa. South Africa as a country is underdeveloped, but when you compare it with other African countries, it is developed or it is developing. Therefore, we want to make sure that when we teach our students, that they are aware that they shouldn't always assume that because most of the people that live in Africa see South Africa as a Mecca. We have huge, huge inequality issues. In actual fact, we've been rated as the most unequal country in the world. Therefore, we want our students to be aware of the complex issues that we're facing. Therefore, when we train our students, we teach them about all these issues that affect people's functioning. The complex issues that I'm talking about, to name the few that most of you are familiar with, we hear our politicians in the media often talking about the triple challenges of inequality, poverty, and unemployment. And these three issues, we have added environmental or climate-related issues, disaster-related issues. Therefore, our program wants to make sure that we address these complex issues. We also have political instability as a country. Our program teaches our students to be political practitioners. We don't only teach you to be social work practitioners, to be counselors and therapists, but we also want you to be politicians, not in the true sense of being a politician that is getting into politics to enrich yourselves. As we know, it's common practice in South Africa. But we want you to be political practitioners, to be policy practitioners, to engage in policy making, to begin to challenge our politicians, to ensure that we are a politically stable country so that we can attract investment and create the jobs that we require so that government can be able to collect taxes and be able to provide social welfare and social security services. Therefore, we want you to engage in ensuring that there is stability in this country. And we'll expect you to engage in advocacy activities, as I've said. We do have a module that focuses on social policy and social development. And that module, you'll learn on how to be politically active and to practice as a politician, to go to parliament, to do policy papers, to do presentations and represent your communities, to influence policies, as government's responsibility is to develop policies. Government cannot develop policies without your influence, because you are on the ground, you are working with people at grassroots level, you will know what the issues are on the ground. Therefore, you'll be able to inform and influence government's policies. I've spoken about climate-related and man-made disasters that we always see in this country. Come winter, we know that in informal settlements, there's always fires, there's people losing their lives and their properties. We know that there's floods. With this rain now, there is La Nina now, that's why we're having rains all the time. People are drowning. Therefore, you will be taught on how to develop programs, as Rahim said, that one of the things that we do and the value that we add is to design programs and projects and interventions that address these issues that I've mentioned above. As well, we are a host to migrants, asylum seekers, and refugees. This morning, Julius Malema has been, or yesterday, he's been going around the malls, campaigning and advocating for people, for South Africans to get jobs. But he's doing this not in the right way. We are a host to migrants. We have a constitution in this country that protects migrants, asylum seekers, and refugees. We've got a moral and ethical responsibility to ensure that the people that are running away from their countries because of instability or because of conflicts and war or because of poverty or economic opportunities, we want to make sure that as social workers, we are trained to work with those people and help them to adjust and be able to settle in South Africa. It's their human right, and it's our ethical responsibility to promote human rights and justice. Therefore, you will be told on how to embrace and support people that are not from here. I've spoken about your role to engage in policy review and development. We have the National Development Plan. We've got SDGs that you are going to be expected to contribute to. Our government cannot achieve the National Development Plan goals that they've set for 2030. Therefore, as social workers, we will train you on how to ensure that the services that we'll be providing, whether we are working with an individual or groups or communities, that you are contributing to the achievement of these goals. As well, and most importantly, you will be taught on how to do research and how to combine research and practice together, because research informs practice and practice informs research. We've got a module that you'll be taking at 4th year, where you will be taught on how to start by identifying the need together with the communities or your clients, and design a research project, collect data, analyze, and produce a report together with the community members. We don't believe that we should do research individually because we believe we're experts. We believe in involving and including the people that the research will benefit, because they know better what their needs are. While you're practicing as a social worker as well, you will be expected as a practitioner to continue to engage in research, because the work that you'll be doing on a day-to-day basis needs to be evaluated to make sure that it is effective. And you can only evaluate through research. Therefore, through research, you'll be able to improve and enhance your social work practice and make sure that your services are effective and are impactful and achieve the desired outcomes. Overall, everything that our social workers will be doing will fall under the ambit of promoting social development. Broadly meaning that we want to make sure that people are socially and economically empowered. Our program, the way it's designed, as I did say, it is in line with our national norms and standards that have been set by the South African Council for Social Service Professions, as well as the Council for Higher Education and South African Qualifications Authority and the Department of Higher Education. These norms and standards ensure that our curriculum meets all the standards that they've been said, is of high quality. Our program will be periodically reviewed. We started with our program last year in 2021. In 2024, our program will be reviewed to make sure that we still are aligned with our norms and standards. And this forces us to ensure that we continuously review and assess how our students are experiencing our program. So if you do register with us, you will be asked after each and every end of term to give us feedback on how you experienced our program. And I'd like to encourage you that if you do come and register with us, that you respond to those calls for student feedback. Because without your voice, without your feedback, we'll never know on how to improve and enhance our program, or how to make your learning productive, effective, and enjoyable. Our program is also informed by international norms and standards. We have an International Association of Social Work with Schools, social work schools. This international association ensures that all schools of social work around the globe are aligned. They meet similar norms and standards. This association makes sure that when you've got a qualification like us, you can go and practice anywhere in the world. Just like Rahim currently is working in South Africa. It's because the BSW program, that the master's program that he in social work that he has, is also aligned with the BSW norms and standards. Social work as a profession is an international program, meaning that With that qualification, you can go and practice anywhere without having to undergo any further examinations or be required to review your qualification. Therefore, SACAP's program was designed to ensure that we are informed by the international norms and standards. We also have a regional forum, the Association of Schools of Social Work in Africa. This is an association that is comprised of all schools of social work in Africa. And we meet regularly to ensure that we are aligned. We compare notes, we share curriculum, we share readings, we do conferences together and seminars together. We involve everyone who is an expert in social work, including practitioners, when we organize our conferences. These are platforms where there is sharing of knowledge, skills, and good practice. Therefore, SACAP is a member of these associations. I am currently the president of the South African Association for Schools of Social Work. This is a South African specific association. This association also ensures that all the schools of social work in South Africa, including SACAP, are aligned. We do exactly the same that is done by the regional and the international. Therefore, I want to assure you that when you register with us, you'll get the opportunity to be a member of these structures. As a South African association, we recently launched an association for students, social workers, last year in September 2021 at an international conference. SACAP is also a member of the Student Association. Therefore, you will be invited in conferences and seminars or colloquiums where you will be engaging with other students from other countries or other universities and colleges. It's because we believe that cross-border collaboration and partnerships are critical, are crucial, are important, and we want to maximize on those opportunities. We are not only going there to learn, but we're going there also to contribute, because we believe SACAP has got a team of experienced educators. Our minimum requirement for someone to teach at SACAP is a master's degree. Therefore, we employ experienced educators, not only in terms of qualification, but also in terms of practice. All our educators have got years and years of experience as practitioners. Therefore, they bring in class not only the theoretical knowledge, but also the practical knowledge, so that they can make your learning enjoyable. We also believe in international collaboration and networks, as I've said. Therefore, we want you to be aware that when you study with us, you will even get opportunities to travel overseas. It's unfortunate that now we've got COVID, therefore international and regional travel is restricted. However, once everything settles down and everybody else is vaccinated and we've got good vaccinations in place, we will be able to resume our international collaborations and travels. There's lots and lots of opportunities to build networks and partnerships with peers across the globe. So now you'll be wondering that there's a lot of people that are saying there's high unemployment in South Africa, and a lot of young people, young graduates, complete the degrees and they end up not being employed. South Africa was in a similar situation a couple of years ago, and it was simply because government at some point issued scholarships because social work was declared a scarce skill at that time. Therefore, government thought that it was critical that they provide scholarships so that we can train social workers and ensure that we don't run short of social workers. Unfortunately, like many other policies, there were unintended consequences. One of the unintended consequences was that we ended up with a lot of social workers that were unemployed. They completed the degree, but they were unemployed. And that was a mistake that government did when they offered the scholarship. They offered the scholarship, but didn't create the job opportunities for graduates when they graduate. But that problem has since been resolved. There's a few social workers that are struggling to find jobs. There's ample opportunities to find jobs in South Africa. As Rahim did say, There's many fields of practice. There's children and families. There's foster care. There's adoptions. There's statutory care, where you're working with young people that are involved in criminal behavior and needs to be taken through the legal system. There's domestic violence, there's divorce, there's substance abuse, there's people with disabilities, there's HIV and AIDS, there's chronic conditions like cancer that are terminal. There's people, the elderly, there's youth development. I mean, the list is endless. There's private practice. Oftentimes, social workers can work in private practice. They can work in government departments. I can assure you, almost all government departments, from education to social development to health to rural development, they have departments where they employ social workers. So you will never run out of opportunities to find jobs. In partnership with government, we've got the NGO sector, we've got the community-based organizations, we've got faith-based organizations that are aligned with churches, we've got civil society organizations that employ social workers. So the choice is yours, where and who you want to work for. In addition, a lot of private businesses in the private sector also employ social workers, because companies work with people and people have problems. They come from families where there are problems. They come from communities where there are problems. And it is an ethical and moral responsibility for the employer to ensure that their employees are taken care of. And one way of doing that is to employ social workers to provide these kinds of services. We also have academic institutions like SACAP that employ social workers. I am a social worker by profession. I have practiced for many years in practice like Rahim, but I did decide to venture into academia. Hence, I am now teaching and being head of faculty at SACAP. Therefore, with your BSW, if you continue to study and get your master's and your PhD, and you're interested in research and teaching, you may end up in academia with your BSW degree. Or if you are passionate about research, purely research, you can work in research institutions like the Human Science Research Council. There's many, the National Research Foundation. There's many research institutes that you could work for. Or you could even start your own and go into private practice, either specialize in research or specialize in therapy or specialize in consulting, anything that you're passionate about. It will be your choice. Therefore, I would want to assure that don't hesitate. You'll never be without a job for more than 6 months, unless you're not connected and unless you're not able to present your CV very well and you're not able to sell yourself. But as a SACAP student, you will be trained. One of the critical things that Rahim spoke about was critical thinking. SACAP's vision and purpose was to ensure that we train our students to be critical thinkers, to be innovative, to be change makers, and to be leaders. Therefore, I want to assure you that with all these skills, you should not be struggling to find a job. Besides the BSW and the work opportunities, there's often the expectation that you continue to study. As a registered social worker, you will be required to continue to develop yourself. There's a requirement that every year you should accumulate 20 points. If you're not willing to get into master's program, and like I said, there's many fields of specialization. We've got clinical social work as a specialization. We've got medical or healthcare. We've got probations. We've got adoptions. We've got EAP. We've got like at SACAP, the social science degree in community mental health promotion. So there's even research. So you will get an opportunity if you want to continue to do a master's degree or even to go into PhD. If you're not willing to do that, you want to continue to work and study part-time, we provide CPD, which is Continuous Professional Development Accredited Short Courses. These are courses that you do either on a 6-week, 12-week, or even 3 days or 5 days. It depends on what the course is all about or what you're passionate about. Rahim is one of the experts that is good and has got a host of other short courses and workshops that he is running and conducting. And we've got other experts as well within SACAP that are providing short courses and workshops. So once you are registered with SACAP and you study through with us, you will be able to become an alumni, and you will be informed about all the opportunities to continue to develop yourself. Oftentimes, employers where you'll be working also provide on-the-job training. Therefore, social work as a profession, if you take it, know that you'll be learning and developing for the rest of your life as you practice. And you enjoy learning because you learn new things every day, and you're improving your skills as a professional and a practitioner. And with your improved skills, it means you'll be adding value to the communities that you'll be working with. Before I take any questions, I just want to share my own personal experience as a practitioner and a social worker. I want to tell you that my role and my work as a social worker has been in many fields. My first job was in a hospital setting. Then I moved into institutional or residential care. I moved into statutory care, working with the court system. I moved into working with HIV and AIDS orphans. I moved and worked with people with intellectual disability. I worked in child welfare. As a result, I've got a vast array of skills. And in my work as a practitioner, I interacted with a host of different people, from the people on the grassroots, the poor gogo that's sitting in the village there, who's suffering from TB and needs to be provided with nutritious meals, to working with youngsters who are passionate about developing themselves, who are just looking for opportunities. And when you work with them and you link them up with those resources, like Rahim said, and you see them 5 years later, they come to you, or they meet you on the street and they ask you whether, do you still remember me? And they relate how you changed their lives. That's how fulfilling being a social worker is. I've been invited to do talks on national TV, in various platforms, in schools, in women's organizations, where I met and interacted with people that are influential, that have influenced my life. I've interacted with international stars like your Elton John, your Muhammad Ali, just as a social worker. And I've traveled, I've been to New York, I've been to Germany, I've been all over as a social worker. Therefore, I want to encourage you to choose social work as a profession. It may not pay as well as other professions like engineering or medicine, but the work itself is fulfilling, because when you change people's lives and you meet them and their lives have been changed, that's the joy of being a social worker. It's far much better than the check that you take home at the end of the month. Thank you very much for listening.
Thanks so much, Poppy. Poppy, I know you've given us a lot of information, Rahim, and your experience as well. So thank you to you both. I see we do have a question in our chat box, and applications for 2022 are still open. As Poppy has mentioned, we do have small classes, and we keep our classes small. So that does mean classes fill up quite quickly. We do recommend that you apply as soon as possible to avoid disappointment.
Okay. I'm a social worker who works with homeless citizens, but I did not take psychology as a second major. What course outlets are available at SACAP in order for me to be introduced to the psychological aspect pertaining to social work? Megan, I think you will have to take psychology from first year up to third year, or honors if that's what you want. Steph, can you add to that question?
I think if you're looking, if you are working full-time as well, SACAP has recently launched micro credentials. which is available on our website. The link to our global site is there, and you'll be able to do smaller bite-sized pieces of our psychology modules in order to then get a background and gain the skills that you need to apply to your current profession.
And also all the online one. We've also got
Yes.
courses online, yeah, that they can take.
So we've got a question that says, hi, thanks for hosting this webinar. What is the difference between the applied social science degree majoring in psychology and counseling and the Bachelor of Social Work degree? I'm a second-year student in the applied social science degree this year, and am currently wondering if a social work degree is better. I'm feeling a bit confused as to what career path to go into. I do know that I want to make a difference in people's lives and help communities and people that have especially experienced physical abuse as kids, and would love to assist in the prevention of this. Would my current degree help me achieve this? Thank you.
Okay, I think these two questions are linked, right? So the applied social science degree majoring in psychology enables you to continue to go into an honors degree in psych, right? And counseling, or you can become a registered counselor. There is a very close link, as Rahim did say, that at SACAP, so psychology and social work are like twins. However, the difference between social work and psychology is that with social work, you work not only in therapeutic spaces, but you work in communities. Therefore, if you want to work in a community, and both social workers and psychologists work with abused kids, the difference is that with social work, we focus more on the socio-economic and political and environmental issues that affect people's lives. And we design and develop interventions in the communities that address these macro level issues, these broad issues that impact people's functioning. We don't only do clinical work, we provide both clinical, also work in groups, but as well in communities. So that's the difference. So they're both similar in a way, but also different in some way, because we place a lot of emphasis on other things that psychology often doesn't do. But we do have a master's in community psychology that is offered by other universities. We offer a master's degree in community mental health promotion. This master's degree is open to both psychology, social work, education, nursing. It's any social science undergraduate degree where you can take and apply both your psychology knowledge as well as your social science knowledge in making an impact in communities, particularly focusing on mental health issues or issues that affect people's mental health and functioning. And we do know that all the complex issues that I raised, at the end of the day, they've got mental health implications for our people. So our master's program is designed in such a way that it can accommodate people with social science degrees.
Poppy, we actually do have a question about our masters. Would you be able to speak into the program, the full-time and part-time, and just how it's delivered at SACAP, please?
Yes. So the way we've designed our program is that we've got 10 modules that are going to be offered online. And in these modules, the classes are held in the evening. Both the Cape Town and the Joburg students combine on the 10 modules. And then we have 4 intensives. These are courses that are taken face-to-face on campus over a period of 4 days. They are intensive, that's why we call them intensives. You come to class from 8 until 5 in the evening. So we've designed our program to enable practitioners who are working to be able to study part-time. And these online programs make it for you to study anywhere, whether you're based in Cape Town or Joburg, in Durban, or anywhere in the world. We're planning to move all the modules to be online, so that through our online program, anyone all over the world can register for our master's program and study. And with this program, you should be able, you learn not only about psychology and social work, but you also learn about business, on how to start a social entrepreneur, to be a social entrepreneur and start a social program, or be a leader and a manager of an NGO in order to promote community mental health. Therefore, it is a program that is ideal for our continent and our South African context, because we know that there's a whole lot of hardships in most communities. So if you have a degree in psychology, or you want to pursue, or you've got a BSW degree in social work, this is the right course for you to take, particularly if you don't want to go into clinical psychology, or you don't want to go into counseling psychology or educational psychology. You can take this master's program. It will allow you to still practice both your psychology and your social work knowledge. There's a question here: do you have funding for prospective students? SACAP doesn't provide bursaries, but we have been able to get a subsidy for our program. Our subsidy has reduced our fees by 25%, and this subsidy is provided from your first year up to fourth year. Therefore, we feel that it's going to hugely decrease the fees that we're charging. Our fees are slightly higher than the public's, purely because we know the quality is also high. But we've made sure that we provide the subsidy as of 2021. And this subsidy, we have also offered it to the students that started studying with us last year. So that's the support that the SACAP can give. But we do have a debit order system. So we've got a range of payment options that our students can choose how they want to fund their studies. Oh yeah, someone asked if there's an age limit. So I think these are the same. Yes, for you with a master's in educational psychology, and unfortunately, if you want to be registered as a social worker, you'll have to start social work from social work 1. It's unlike in America. In America, you can do a master's degree in social work, like say Rahim has done, where you can go into master's with any other undergrad degree in the social science. Unfortunately, the system is different in South Africa. You have to do social work. But I can assure you, the years run so quick. 4 years is nothing, and age is not an issue at all. Currently in our class, we have got students that are in their 50s, and they're doing extremely well.
Poppy, just wanted to know, would you be able to speak into a current student doing the Bachelor of Applied Social Science degree, majoring in psychology and counseling? How would they go about doing the social work degree? Would they be able to credit in, or would they need to also start the program from the beginning? And what would you advise?
Yes, we will credit some of the psychology modules that they already have, but we can credit about 50% of the modules, and they cannot move ahead. They've got to move with the cohort. So if they have psychology 2, for instance, they can't move into psychology 3. They'll have to do the second year modules and be on par with the other students. We do credit, other psychology modules.
Thank you, Poppy. And then I think this last question would speak into the role and the work integrated learning module. We have a question that says, I'm unsure if we'd obviously be able to answer this question. I'm not sure if we'll be able to answer it in depth, but I'm sure Poppy will be able to give us some insight. There is a child welfare organization that offers internships to social work students, both second year and final year students. With my degree of applied science, second year student, majoring in psychology and counseling allow me the opportunity of interning there. So would the current Bachelor of Applied Social Science degree allow them to intern as a social worker? I'm assuming that's the question, Poppy.
As a psychology student, it will depend on the organization. If it's a child welfare and they're providing clinical social work, that would normally be provided by a psychologist. You could negotiate with them and ask them to give you an opportunity to practice. I cannot answer for child welfare in Cape Town. I don't know what their policies are.
That seems to be all the questions we have at this moment. If there are any questions that you have that you haven't had a chance to ask, and then also if you would like our team to contact you, please feel free to leave your email address in the chat box or the Q&A box. Rahim and Poppy, I'm not sure if you have any closing statements or comments for us.
Yes, I would just like to add that we're still open for intake. We are busy interviewing, and our interview process really is to get to know the applicant, and understand what challenges they anticipate encountering, so that we can make sure that we can support them and we've got the means to support them. So I would like to encourage our guests tonight to contact us. It's not too late to apply. Like I did say that we offer 25% subsidy. Therefore, I would like our participants to apply. And like you did say, Steph, if they've got other further questions, they can email us and we'll get back to them. And thank you for listening to us.
Thank you. Thank you so much, everybody. And thanks, Poppy and Rahim, for sharing with us this evening. We'd like to personally welcome you to our upcoming open days. If you do have any questions, not only about our social work degrees, but any other degrees, if you are a current student and you do still have questions, please feel free to join us. You can RSVP with the link in the chat box. As mentioned previously, if you missed any parts of this webinar or you'd just like to rewatch it again, it will be available on our social media channels. So please do follow us. You will also receive any announcements on new programs, developments, and course information on our social media pages. Thank you once again for joining us, and thank you to Poppy and Rahim. Have a wonderful evening further.